Good morning, everyone. My name is Wan Jing, and today I'm going to interpret the normal X-ray. So first, I will check all the patient detail, which is the name, IC, and gender to confirm this patient. Then next, I will ask patient when is the X-ray taken and where and why patient need to take this X-ray. Then next, I will use the A, B, C, D, E, F method, which is the A is airway. So I will check patient trachea, see any trachea deviation or any blockage in the trachea. And B, I will check all the bones, got any fracture and any dislocation of the bone. And C is cardio. I will check patient heart size and heart shape. So if patient have the enlargement of the heart, maybe patient will have a cardiomegaly. And D, I will go to the diaphragm and I will assess the diaphragm and the costophoric angle with bilateral ray. And E, I will check everything else, which is I will review and assess all around the lung field, include the subcutaneous soft tissue and pleural boundary. And F is field. And finally, I will review all the lung field looking of any mass and pattern of the blood vessel, which is include the vein and artery. Thank you.
Good morning, everyone. My name is Nehala, and I'll be talking about pneumothorax. So, pneumothorax is a lung condition where there will be air collected in the chest area. So, this will be the X-ray findings for this condition. First of all, is the presence of the visceral pleural white line, and then there will be absence of lung markings distal to the pleural white line on the chest. And next, the accentuated expiratory film, which the lung volume is reduced while the pneumothorax remains constant. Next, there will be a displacement or shift of mediastinum with total or subtotal lung collapse. And the last part, there will be a chest X-ray which will be taken in a supine position, and that will show a deep lateral costophrenic sulcus, or as known as a deep sulcus sign. Thank you.
Okay, very good morning. My name is Sharmila Ijan. So today I'm going to be presenting about the chronic obstructive pulmonary disease. So COPD is actually where the lung disease inflames and also obstruct the airway flow. So usually the X-ray findings would be flattening of the diaphragm, and then you see a lucency of the lungs, increased lucency of the lungs, and then the heart would be long and narrow, and there would also be an abnormal air collection within the lungs. That's all. Thank you.
All right, hi, my name is Justin. So today I'm going to talk about what is pleural effusion. So pleural effusion is the excess fluid which is collected between the layers of pleura, and there is three signs where you can see or identify its pleural effusion. First is the meniscus sign. It's when there is fluid that is accumulating in the layers of pleura that would form a concave meniscus along the lateral chest wall. And then second is there is a lateral and also a erect sign that shows when there is fluid present. And the third one is there is a mediastinal shift when there is more than 1,000 milliliters of fluid collected in the pleura. Good afternoon, my name is Justin, and today I'm going to explain what is percussion and vibration. So firstly is percussion. Percussion is a manual technique that we use to help clear phlegm or sticky substance that is in the lungs or around the lungs. And first, what we need to prepare before doing the percussion is we need to make sure the patient is in a comfortable position. So sit inside it. And then you will use a thin towel to avoid pain to the patient. So like this, okay. And then need to adjust the bed. So I can adjust this bed. Need to adjust the bed to be comfortable for the patient. As you need to make sure that you are doing it continuously for some time until the patient can cough. Okay. And while doing percussion, you make sure your hand is cup position, and when you do the percussion, you need to make sure it has a hollow sound, so something like this. And you do it continuously until the patient wants to cough. Next is vibration. So vibration is also a manual technique that we use to clear the phlegm. So same, this one you need to use both hands. But the difference between vibration and percussion is that vibration you can involve gravity positions that help to clear the phlegm. So for example, it's Miss lie on your side. This side. And then you can ask the patient to lie on the pillow. So this one can help the drainage. Okay, and you can choose to use a towel or not. So I prefer to use a towel, and you would do vibration like this. So make sure you're not vibrating on any bone prominence for both the percussion and vibration so that it doesn't hurt the patient and it doesn't hurt you. And try to not do on places like the stomach or vital organs like the liver or the heart, as this will affect the organs. So for vibration, you will do make sure you're using your straight hand, and then try to use as much energy as you can, and make sure it's actually vibrating the lung and you're not just vibrating the patient's body. That's all.
Good evening to Dr. Azrul. My name is Mehala Pantin and I'll be explaining about incentives parameter, Bolidine, and also the trifluorometer. So incentives parameter or Bolidine is like this. So it comes with the main chamber with the piston attached to it, and there's a tube and then a mouthpiece attached to it, and then there will be a inflow indicator in yellow. It states good, better or best, the 3 levels, and also there will be a marker set by the physician or the physiotherapist or the pulmonologist for the patient to achieve the target of the volume that is to be achieved. So for example, 1500 ml to 2000 ml for the female patient after the surgery. So for this, the procedure is to be done asking the patient to sit in upright, relaxed, comfortable position and place the device in the eye level of the patient, and then the mouthpiece you have to put in the lips and seal it tightly so that the air doesn't escape out, and then take a deep inhalation and inhale as much as you can, slow and deep breathing, and make sure the volume of air, the level is at the best or the better, that either that level. So if possible, ask the patient to hold for 5 seconds and then relax. In between, if the patient is feeling lightheadedness or dizziness, then they can stop the procedure immediately and then resume it and have to do this exercise for 3 times and get a mean value of the volume of the air. So next one will be the trifluorometer. Trifluorometer comes with 3 colored balls in the main 3 chambers, and then is attached with a piston and the tube, and then it comes with the mouthpiece at the end. So for this one, the main goal of this procedure is to make sure the patient can inhale and lift all the 3 balls up. So each colored ball has the different magnitude of the force that is needed to lift it up. So if the patient can lift all the 3 colored ball up to the maximum level, that will be the very good inhalation. So the procedure is the same, and the attempts for this procedure can be 3 times until the patient can reach the maximum level of the 3 balls to be lifted up. So that's all from me. Thank you.
Good afternoon, patient and physiotherapy student. My name is Wan Jing. Today, in the case I get to know you have some difficult breathing, so I will give you some exercise to improve your ventilation and improve your breathing. So in the procedure, I will touch some body part. If you got any discomfort, please tell me and I will stop immediately. So my concern. Yes. So first, I will give you the ACBT breathing technique, which is active cycle breathing technique. So to improve your breathing. So step is breathing control. So first, I will position patient in very relaxed and comfortable position, which is the sitting position, and I will ask patient to put the patient hand over the abdomen, and ask patient to breathe into the nose and breathe out to the mouth. 1, breathe in and out. In between, I will observe patient hand. So when patient breathe in, the abdomen must be upward, and breathe out, patient the hand must be inwards. So breathe in, breathe out, and repeat for 3 times. Okay. Next, I will go into the second step, which is the thoracic expansion technique, which is I will ask patient to, also the same in the sitting and comfortable position. So ask patient to put the hand and hold over your lateral ribs, and ask patient to breathe into your nose and hold for 2 seconds. 1, 2, and breathe out. And at the end of the expiration, patient must be against the resistance out. Okay, repeat for 3 times. Breathe in to your nose and hold for 1, 2, and breathe out. At the end of the expiration, must give minimum resistance and against the resistance. And repeat for 3 times. And next, I will go into the breathing control again, which is ask patient to put the hand over the abdomen and breathe into your nose and breathe out to your mouth. And in between, I will observe patient abdomen and hand. Okay, next I will go into the forced expiration technique, which is coughing and huffing technique. I will position patient in sitting position also, in very relaxed and comfortable position. And I'll ask patient to breathe in to your nose deeply
and forcefully half out. Okay, and I will bring some plastic bag to give patient to speed up the sputum. So patient will repeat all the steps in 3 times and repeat for 3 times. So this all for the ACPT technique. So thank you, patient.
A very good afternoon, sir. So today is Azrul. So today I am going to present about positions to prevent bed sores. So first, the few areas that bed sores would happen is usually behind the head, and then at the shoulder blades over here, and then usually at the elbows, behind the elbows here, the back, and the sacrum area, and then the heels. So this is the first position. So this is just supine lying. We put a pillow underneath the head over here, and then behind the elbows, both sides, underneath the knees, and also underneath the ankle here to elevate a bit the ankle. So this is the second position. It's called half lying. So we usually in the hospital we can bring the bed up, right? So with that we have to make sure that the back is always either 45 degree incline, and then we put pillows below the knee and also the ankles. Okay, so this is the third position. This is side lying. So side lying, what I did is I put a pillow behind here to protect the shoulder blades over here. Okay, so then on the front, I ask the patient to hug the pillow to make sure that the elbow is not touching the surface for a long time, and then the head, definitely there's a pillow over here. Okay, for the knees, I will put in between, I will put a pillow, and also for the ankle to prevent any bed sores over here. So this is the third and last position.